Greetings, everyone. My name is Dr. Stanford, and I'm a physician and surgeon, board certified in both adult and pediatric surgery, here today to talk to you about the coronavirus. So many of my friends and family have been asking me about it, so I want to dispel some myths and give you the facts. So let's jump into it.
What is coronavirus?
Coronavirus is an RNA virus that needs a host or a human to survive. As we know, it was originated in bats in China, and from the bodily fluids and or feces, saliva from that animal was contracted by humans. The coronavirus is transmitted by respiratory droplets. So if you are within 6 feet of an individual who has a fever, who's coughing, or who's short of breath, you can contract the coronavirus. Additionally, if that virus is on a surface that you touch and you touch your face, you can contract the coronavirus because it will enter your mouth, your nose, or your eyes. You prevent coronavirus with perfect hygiene. Wash your hands for 20 seconds minimum, hot soapy water, followed by a hand sanitizer with a minimum of 60% alcohol base. That should kill the majority of viruses.
What are the at-risk groups for developing coronavirus?
The at-risk groups are the elderly, those who may be immunocompromised and have comorbid health conditions where their body is already fighting against some other disease or condition. Also, pregnant women are at increased risk, and this time children are at a decreased risk compared with the elderly. However, everyone is at risk for developing coronavirus.
What are the risk locations for developing coronavirus?
The risk locations for developing coronavirus are areas that you might be in tight confines and there's not a continual flow of new air or circulation. So that is an airplane, it's a dormitory, it's a daycare center, for example, where folks are in close proximity, where you may be hugging a lot, or kissing someone on the cheek, shaking hands. Because again, the virus can live on your hands, and then when you touch your face, which we all do different times of the day, is how it's contracted. So those particular areas are at greatest risk.
What should you do if you suspect you may have been exposed or have the coronavirus?
If you suspect that you may have the coronavirus or you've been exposed, you should go to your doctor, go to a local emergency room, go to an urgent care, and share the symptoms that you're having. Again, the symptoms, a fever, cough, and or shortness of breath, and you can be tested for coronavirus. It's important that you're tested, not just so you can start treatment, but also so you don't potentially spread the disease to others.
Why is testing important even when there's no cure?
I'm glad you asked that. Testing is important even when there's no cure is because we need to know how many cases are developing and at what rate. Is this an epidemic, meaning it's something that's happening in a localized area where a lot of people are getting the disease, or is it a pandemic like the swine flu was in 2009 where there were multiple people getting it across multiple countries and continents throughout the world? So it's important that we know the rate in which people are developing coronavirus as well, so we can alert the public and people can take necessary precautions.
What is the difference between a surgical mask and an N95 mask?
Wonderful. So a surgical mask, or the ones where you see people just putting behind their ears, they're often blue or yellow, they are porous, which means after about 10-15 minutes, they become moist and they are no longer protective. They also do not have a tight seal, so it can allow for respiratory droplets to come in. The N95 mask is a mask that prevents respiratory droplets. As healthcare professionals, we are fitted for this mask to make sure it's the correct type. It can last for 12 hours when we are on a shift to prevent us from contracting the virus if we are caring for individuals that may be able to spread the virus to us. and also preventing us from spreading anything to another individual. I should mention though, everyone does not need to wear a mask. In fact, the N95 masks are in short supply because people are buying them. However, if you are caring for a loved one who has been exposed to coronavirus, then you should be wearing a mask to protect yourself.
What is being in isolation versus quarantine?
So the difference between isolation and quarantine, isolation is that you are a known person who can potentially make someone else develop the disease. So you are, in effect, contagious. Quarantine means you've been in an area where someone did have the virus, but you are not yet displaying symptoms.
Are men and women equally affected?
Men and women are not equally affected when they contract the coronavirus. Men, unfortunately, have a more severe course. It's not completely understood, but we do know that in China in particular, where there are more men smokers than women, the cilia are affected by smoking. And that's smoking everything. Cigarettes, weed, pipes, whatever, are affected, and they don't allow you to remove virus and bacteria from your lungs. And so for that reason, we know men are more affected and have a more severe course than women. Also, middle age, 50-year-old men and up also are having a more severe course than women. Women are also thought to have a stronger immune system, not completely understood why. It has something to do with the immunity we confer to our children. But again, men are affected and express the disease in a more severe form than women.
Is it safe for me to travel?
Is it safe? I would weigh every time you're about to travel, is this trip absolutely necessary for you to go? Because again, a plane is a place to harbor a lot of viruses and bacteria. So if you do need to go, National Geographic put out an article that the window seat is actually the safest place. After a window seat, the middle seat is the safest place. The aisle is the worst place to sit on a plane because you're in most contact with many people going up and down the aisle. And remember, if you're within 6 feet, those respiratory droplets can be in your mouth, eyes, and nose. Also, if you have to travel, having Clorox bleach wipes, wiping down all the surfaces that you may come in contact with. And even though I mentioned that the masks are for healthcare workers, again, the N95 mask, and those who are caring for individuals known to have the coronavirus, if you're in close proximity to someone who is coughing or sneezing, there's no harm in you putting a mask on your face to protect it from at least going into your mouth. That does not protect it from going into your eyes or your nose, however.
Is there anything else that we should know about the coronavirus that you didn't speak about today?
I would say for every family, you should have a plan. Right now, this is an epidemic. It certainly could become a pandemic where it affects multiple countries, multiple continents, and large numbers of individuals. So that means water in your home for at least 30 days. That means non-perishable items, canned goods, frozen goods, and making sure you have a manual can opener, not electric. It means having sanitary wipes, bactericidal wipes, having toilet paper, having laundry detergent, that you can keep your home and surfaces clean. And again, if you don't need to travel, if you don't need to be in tight confines with people, choose not to do it. Thank you for taking the time to listen. I hope that some of the information you heard today was helpful, maybe even new information. And please feel free to reach out to me. You can DM me on Instagram or Facebook, and look at the links for the CDC and also the WHO, who are providing up-to-date information about the coronavirus and how it's affecting us right now.